think about a time you tried to truly understand someone, whose background was completely different from yours.
Yeah, it can be really eye-opening.
Right. Now, imagine that, but amplify it with all the complexities of mental health care.
Mm.
What if the key, like the real key to unlocking better support, lies in understanding not just the symptoms?
But the whole person,
Mm.
their cultural, their spiritual framework.
Exactly. That's the deep dive we're taking today. We've got this fantastic resource,
Oh, yeah.
a chapter from Psychiatric Mental Health Nursing, Concepts of Care in Evidence-Based Practice.
Okay, solid source.
And our mission, basically, is to pull out the essential insights about these cultural and spiritual concepts.
And how they really impact mental well-being.
You got it. Think of this as your shortcut to understanding these really crucial elements.
Good stuff. So what are we covering?
We'll hit cultural concepts first, culture itself, ethnicity, race, and then these specific cultural phenomena that affect healthcare.
Okay.
Then we'll shift to spiritual concepts, spirituality, religion, spiritual needs.
And how they connect, or sometimes differ.
Right. And we'll wrap it up with nursing implications and look at a real-world case to see it all in action.
Perfect. It's so easy in healthcare, isn't it, to kind of fall into routines.
Oh, definitely. Assume everyone sees things the same way.
Right. Assume this sort of universality of experience. But this chapter really highlights just how much our cultural and spiritual lives influence things.
Like how we see illness.
Exactly. How we see illness, how we seek help, even how we communicate what we need.
And what gives us strength, maybe?
For sure. Strength and meaning when things get tough. It really pushes us to look beyond just the clinical data.
Okay, let's dive in them, starting with the basics, those building blocks. The chapter defines culture as, well, like this incredible tapestry.
A tapestry, I like that.
Yeah, of shared beliefs, values, customs, behaviors, even like the objects a group learns and passes down.
It's sort of the shared software for a group, learned over time.
It's like the air we breathe, socially speaking. It shapes so much, often without us even realizing it.
Absolutely. And a key thing is that culture isn't static, right?
Totally.
It's not some fixed thing.
No, it changes.
It's constantly evolving, influenced by all sorts of forces, internal, external. That gives us that first framework for how we interpret the world.
And our place in it, which is huge when you're talking about something as personal as mental health.
Huge implications.
Okay, so that's culture. Then we have ethnicity, and this seems more about identifying with a specific group based on shared roots.
Yeah, shared cultural roots like common ancestry, maybe language or religious traditions.
So you could be, say, American, but also identify strongly with an Irish American or Italian American ethnic group within that.
Exactly right. Ethnicity often gives this really powerful sense of belonging.
A shared history?
A shared history, a network of support. And that can be incredibly important for mental well-being, kind of a buffer against stress.
A source of resilience.
Definitely.
And then race. The chapter is quite clear on this one.
Yes, it is.
It states race isn't biological reality, it's a social construct.
A way societies categorize people based on physical characteristics. That's the core of it.
And while it's not strictly cultural or spiritual in itself,
its impact is undeniable. The social construct of race has had, well, a profound and often very negative impact on individuals and communities.
And those experiences can significantly affect mental health, access to care.
Absolutely.
Yeah.
Creates barriers, introduces specific stressors. It's a critical factor.
Okay, so we have those definitions. Culture, ethnicity, race. Now the chapter gets into what it calls cultural phenomena affecting healthcare.
Right, this is where the rubber meets the road, so to speak. How these differences show up in healthcare settings.
First up is communication. And it's way more than just speaking the same language, isn't it?
Oh, absolutely. Language access itself is critical, of course.
Yeah.
You need qualified interpreters, that's baseline.
But beyond that.
Beyond that, you have to consider all the nonverbal stuff. Things like eye contact.
Touch.
Personal touch, yeah. Even silence. These things can mean vastly different things across cultures.
Can you give an example? Like eye contact.
Sure. In some Western cultures, direct eye contact often means you're being respectful, you're engaged.
Right.
But in other cultures, that same direct eye contact might feel confrontational, disrespectful even.
Wow, okay. So misinterpretations are easy.
Very easy. And even communication styles. Is someone very direct, getting straight to the point?
Or more indirect, kind of circling the issue.
Exactly. That difference alone can really influence how a patient and provider interact, and crucially, how well medical information is actually understood.
Yeah, you can totally picture a situation where a well-meaning doctor's direct questions might feel rude or invasive to someone from a different background.
And shut down communication right there.
Okay, the next phenomenon is space, our personal bubble.
Yeah, personal space preferences, we all have them, but we might not think about the cultural angle.
How much they vary.
They vary a lot.
Hmm.
What feels like a normal, comfortable distance to me might feel way too close, intrusive to someone else.
Or maybe too far away, like the person seems cold or distant.
Exactly. It can feel uncaring. And this affects everything from, physical exams to just having a chat at the bedside.
Mm-hmm. Okay, then social organization. This looks at family, community.
Right. The influence of family structures, community networks, religious groups on health, and healthcare decisions.
So, like, who makes the decisions?
Yeah, think about cultures where medical decisions aren't just up to the individual. They're made collectively by the family or elders.
So, if a doctor only talks to the patient.
They might face resistance, yeah, because they haven't included the family in that culturally expected way.
And community or religious networks?
They can be huge sources of support and healing, powerful stuff. But sometimes they might also hold beliefs that differ from, say, standard medical advice. It's complex.
Okay, fourth one, time orientation. This is about whether a culture focuses more on the past, present, or future.
Exactly. And how that perspective shapes attitudes towards health.
How so?
Well, a culture with a very strong present-time focus might prioritize feeling better right now.
Over maybe preventative care or sticking to a long-term medication plan.
Precisely. Whereas a more future-oriented culture might be more willing to, say, make sacrifices now for expected health benefits down the road.
That makes sense. Affects appointment keeping, following treatment plans.
Big time.
Okay, next is environmental control. This sounds like beliefs about control over health.
Yeah, beliefs about how much control people feel they have over their own health outcomes and how much they accept medical interventions.
So it's a spectrum.
Definitely.
Hmm.
From a strong belief in personal responsibility,
Yeah.
Diet, exercise, determine health, all the way to a perspective that health is more about fate or luck.
Or maybe supernatural forces.
Or supernatural forces, yeah. And these beliefs really impact whether someone seeks medical care in the first place and if they follow through with treatments.
Right. If you believe it's fate, why bother with the difficult treatment, maybe?
That could be the thinking for some, yes.
Okay. And the last cultural phenomenon listed is biological variations.
hmm This acknowledges that, yes, there can be some genetic predispositions or metabolic differences.
Or different rates of certain diseases among various ethnic groups.
Exactly. Things like, say, higher prevalence of sickle cell anemia in people of African descent, or lactose intolerance being more common in certain Asian or African populations.
But the key is avoiding generalizations, right?
Absolutely critical.
Yeah.
We must avoid stereotyping. Everyone is an individual. But being aware of potential biological variations can help inform our understanding of risks and tailor care a bit better.
Okay, that gives us a really solid grasp on the cultural side. Now, the chapter shifts gears a bit to spiritual concepts.
Yes, equally important.
It starts with spirituality, defined as a personal search.
Yeah, a very personal search for meaning, for purpose, a sense of connection to something larger than oneself.
And crucially, it says this doesn't have to involve organized religion.
That's a key distinction they make. Spirituality is often more individual, more internal.
What gives your life significance?
Exactly. How you find connection, maybe through nature, art, relationships, a sense of transcendence, whatever it is for that person.
Okay. And then religion is defined more as the structured system.
Right. An organized system, specific beliefs, practices, forms of worship, connecting people to a higher power or divine being.
So religion often provides the framework.
For expressing spirituality, yes. It offers rituals, communal practices, moral guidelines, that sense of belonging to a community. For many people, it's a huge source of comfort and strength.
Got it. So building on those definitions, the chapter talks about core spiritual needs. First one is meaning and purpose.
That fundamental human drive, isn't it? To understand why we're here, what our lives mean.
Is this become more important during illness?
Often, yes. During illness, loss, big life changes, that need for meaning can become really pronounced. Finding some sense of meaning can be incredibly powerful for building resilience.
And fostering hope.
And fostering hope, absolutely, when things are tough.
Which leads to the next need, faith, belief in something beyond ourselves.
Yes, something that gives hope and strength when things feel uncertain.
And again, this doesn't have to be strictly religious faith.
Correct. It could be faith in a positive future, faith in humanity, faith in a higher power. It's about having something to hold on to that provides comfort, courage.
Okay. And then the need for hope itself, expecting positive outcomes.
Hope is just vital for mental and emotional health, isn't it?
It really is.
It fuels our motivation to cope, to heal, to keep going through challenges.
Yeah.
Even in the darkest situations, holding on to some sense of hope can make a profound difference.
Then there's love and belonging, feeling connected, valued.
Basic human need, isolation, loneliness. They can be devastating for mental
I
health.
saw that during the pandemic.
We really did.
Huh.
Feeling loved, accepted, part of something, it provides security, support, purpose. It's a powerful buffer against stress. Hugely important for well-being.
And finally, the chapter highlights forgiveness, letting go of resentment.
Yeah, letting go of resentment, bitterness, anger towards others or even towards oneself. Ultimately, finding some inner peace.
Because holding on to that stuff is.
It can be incredibly toxic,
Not fair.
emotionally, even physically. The ability to forgive when possible and appropriate is often a really crucial step towards healing.
Okay, so we've covered these vital cultural and spiritual concepts. How does this all translate into, actual nursing care, the practical stuff?
Right, the nursing implications.
First, and maybe most basic, cultural assessment.
This means actively, respectfully trying to understand the patient's background, their beliefs, their values, their practices.
How do you do that?
Asking open-ended questions, really listening to the answers, showing genuine curiosity and respect for their view, not making assumptions.
And tied closely to that is spiritual assessment.
Same idea, identifying spiritual needs, resources, beliefs, and always honoring their diverse perspectives, even if they're very different from your own.
It's not about pushing your own views.
Absolutely not. Not about imposing anything or trying to convert someone. It's about understanding what gives them comfort and meaning and how we can support their spiritual well-being during their care.
The chapter also really hammers home the need for avoiding stereotyping.
So important. Just because someone belongs to a certain cultural or religious group.
It doesn't mean they all think or act the same.
Exactly. We have to see each patient as a unique individual, their own experiences, their own interpretation of their culture or spirituality. Assumptions are harmful.
Leads right into culturally competent care then.
Yeah.
Adapting what we do.
Yes. Adapting our nursing interventions, our approaches, so they align better with the patient's values and beliefs.
So that might mean changing communication style?
Could be. Or being mindful of personal space, accommodating religious dietary needs, respecting prayer times, involving family in decisions if that's the norm.
Tailoring the care.
Tailoring care to the individual, that's the goal.
And lastly, collaboration. Working with others.
Definitely. Using interpreters when needed, obviously. Connecting patients with spiritual leaders or chaplains if they want that.
Using community resources.
Utilizing community supports that might offer culturally sensitive help. These collaborations are invaluable for bridging gaps and ensuring truly holistic, respectful care.
Okay, to make this really concrete, the chapter gives a case application.
Ah, good. Let's hear it.
It's a 45-year-old Muslim woman hospitalized for depression. She expresses a strong desire to pray 5 times a day, as per her faith,
Good.
and also to follow halal dietary restrictions.
Right. Very specific, important needs for her.
So how would a nurse approach this using the cultural and spiritual competence we've been talking about?
Well, first step is always assessment. The nurse needs to understand the significance of these practices for her.
Not just that she wants to pray, but why it's important.
Exactly.
Yeah.
Why are the 5 daily prayers meaningful to her? What exactly does halal mean in terms of diet? Ask respectful, open questions to really get it.
Okay, after assessment.
Comes planning. Based on that understanding, the care team works together. They need to plan her daily schedule to try and accommodate those prayer times.
As much as possible given medical needs.
As much as reasonably possible, yes. And coordinate with dietary services to make absolutely sure she gets meals that meet the halal guidelines.
Then implementation, putting the plan into action.
Right. This might mean finding a quiet, clean space where she can pray without being disturbed at the right times.
And making sure the meals are correct.
And ensuring the meals are prepared and served correctly. It's about actively helping her practice her faith while she's getting care, facilitating it.
And the final step, evaluation.
Checking in. How is it going? Is she able to maintain her practices? Is it helping her feel better, cope better?
Assessing the impact on her mental health.
Precisely. Is it providing comfort and support like she hoped? Do we need to adjust anything? It's that ongoing cycle. Assess, plan, implement, evaluate.
All guided by sensitivity and respect.
Sensitivity, respect for her beliefs, and understanding their importance to her recovery.
So as we kind of wrap up this deep dive, the main takeaway seems incredibly clear.
Yeah.
These cultural and spiritual dimensions, they aren't just like optional extras in mental health care.
No, they're fundamental.
Fundamental aspects of who we are, how we experience the world, how we cope. Recognizing them, understanding them, respecting them.
Is absolutely crucial for providing care that's actually effective, compassionate,
Mm.
person-centered.
And leads to better outcomes in the end.
It really makes you think, doesn't it? How much richer our understanding of well-being becomes when we actually acknowledge these diverse cultural and spiritual landscapes.
Moves us beyond just the biological.
Way beyond, towards a much more holistic view of what health really means.
That's such a valuable point. And for you listening, maybe take a moment to reflect on that.
Yeah.
How has your own cultural or spiritual background, maybe consciously or unconsciously, shaped your understanding of health and well-being?
Good question.
And thinking about how a more conscious awareness of these influences in yourself and in others, how might that lead to more empathetic, more insightful interactions, not just in healthcare, but, in all parts of life?
Yeah, definitely something worth considering long after this deep dive is over.